Hi everybody, I'm Dr. Sam.
And I'm Samantha.
Today we're going to talk about mastopexy or a breast lift.
What are your ideal candidates for a breast lift?
So the idea behind a breast lift is for people that have a lot of ptosis or sagging. So what the idea behind it is that we lift up that breast tissue and recreate a more youthful shape to the breast. So it could be anyone that has that ptosis or sagging. Ideally, the best people and the most typical patients are moms that come over for a mommy makeover. It may often even be combined with a tummy tuck or separated depending on each patient.
So what if I wasn't happy with my size, where I had smaller breasts than I ideally wanted, but I also wanted them to be a little bit lifted at the same time? What would you recommend for me then?
So that's a great question. Sometimes putting an implant in alone, so breast augmentation, will create a lift effect. So it depends on the amount of ptosis that they have, how much laxity and how much tissue they have themselves. Sometimes we need to do a lift and an implant placement, which we do fairly often. So it's very variable from person to person, and that's something when we meet and we do measurements, we can discuss what the goals are and what's the best way to achieve them.
So does this surgery require me to stay in the hospital at all?
No, this is an outpatient surgery. So we typically would do it in an outpatient surgery center. We pick nice, pretty places that are easy to get in and get out compared to the hospital. The hospital is a big to-do, and it's actually much more costly to do it in a hospital. There's still the same anesthesia, perfect staff, and our outcomes are very good doing it in the surgery center. You come in the morning of, and you go home the same day. You just need a family member to take you home.
Okay, and so what would you say my downtime would be after this surgery?
So the good thing about doing breast surgery, especially if we're just doing soft tissue like a lift, is we're not doing work with the muscles, and that's what the greatest source of pain are for patients when we do breast augmentation, for example. So the actual downtime is minimal. I would say about 1 to 2 weeks before you're able to do 90% of the things you need to do. In the beginning, we just don't want you to be doing a lot of upper extremity activity, so no lifting with the arms and nothing heavy for the first couple of weeks. But for the most part, people are feeling well after a few days.
And let's say I'm that patient that I want to have the lift combined with a breast augmentation and implant at the same time. Then what does the downtime become?
The downtime is still about the same, right around the same 2 weeks. There's a little bit more pain associated with that because oftentimes when we are doing a lift combined with implant placement, we will go under the muscle, and that there is more soreness associated with that.
And then after surgery, do I get one of those fun post-op bras that women I see wear?
Exactly. So
Okay.
in the operating room, we have special bras that are made for surgery. They have latches in the front, so they're easy to take on and off, and straps on the top that also free. You will be in those. What we don't typically give patients are drains, so those are the tubes that come out. When we do the surgeries, we try to avoid those as much as possible in this situation.
And afterwards, when you're talking about wearing my own bra, are there any restrictions? When can I have an underwire bra again?
Great. So we typically say no underwire for at least 6 weeks, sometimes even longer depending on where we make our incisions. If there are incisions on the bottom, we would push that even out to about 3 months. The underwire can actually cause wounds in those patients, and they don't allow nice healing of the breast. So sports bras are great. Anything without an underwire is fine, but the underwires we avoid, like we said, 6 to 12 weeks.
And is that for all breast surgery?
For the most part, that's a rule for all breast surgery, yes. So breast reconstruction, the same thing. Breast augmentation, the same thing. Lifts and reductions, also the same.
Okay.
I'm Dr. Sam.
And I'm Samantha.
Thanks for watching.